This initiative came just a few years before COVID. One of our professors from Idaho State University was on sabbatical leave, where he met our associate dean, Professor Louis Pretorius. And during their conversation, they spoke about where she raised her concern on the maternal death in our country, where she was really concerned what can be done for them to assist us as a country. So that brought a memorandum of understanding between the University of Namibia and the Idaho State University in 2019. And because of that memorandum of understanding, last year, which is now 2024, the School of Nursing and Public Health, which is part of the University of Namibia, developed this partnership where they needed to look into how do we help the country to reduce maternal and neonatal death. We should remember that the mission of the University of Namibia is to contribute to the achievement of the national and international development goals. So now the question was that how can we contribute to this? Because we needed to look at the world roadmap, which is looking at to reduce preventable death in our country. And then the other one is also to contribute to the sustainable development goals. So that led to the two universities, which is the University of Namibia and Idaho State University, to come up with an initiative which is now the ALSO. They call it an ALSO training, which is actually an advanced life skill in obstetrics and also combined with helping baby breathe training. So this is an initiative that started in 2024, where instructors from Idaho University came over to Namibia, a group of them, where we trained first our advanced midwifery students, because the School of Nursing is offering a postgraduate specialization for midwives. So these students were trained in this also training and helping baby breathe. So the importance of this training before it went to Outapi was like, when you look currently at the figures in our country, we are standing almost at a maternal death of 215 per 100,000 live births, while our neonatal death is around 20 babies die among every 100 live births of babies in our country, which is actually, we are so behind with the sustainable development goals, where we want to have, rather than 215 mothers die, at least only 70. As well as rather than having 20 babies die, we have only 12. So this training, which is now the ALSO training, include important hands-on training with the simulated equipment, the advanced simulated equipment, and it really look into training of the midwives. Actually, there are some case studies, like case studies on postpartum hemorrhage, which is one of the major causes of death in Namibia among our mothers. There are septic shock and preeclampsia. So the ALSO training, which was initiated, it looked at the preventable death among our mothers, that is our pregnant mothers, and also immediately after birth. Mm-hmm. And most of those causes, as I say, is postpartum hemorrhage, is our hypertension, especially the preeclampsia, which is an hypertension that only comes during pregnancy and it's killing around 12.5% of our mothers. And then it's also pregnancy-related infections. And then for sure among our babies is a premature babies. Most of our babies are born prematurely around 22.9%, which is around 54 out of 235 babies. Mm-hmm. So this training started in Windhoek, where advanced midwife students were trained, plus some of the senior registered nurses from the hospital. They were trained to become ALSO providers. At the same time last year, around this June, there was also a training that was now for the faculty members. This initiative is driven by the midwifery department, where I'm the head of the department. We were also trained to become ALSO providers. Mm-hmm. So after we were trained last year, because it's a collaboration, this year now 2025, where we found ourselves in Outapi, is where we decided to say, okay, fine, we want to go out to the regions, because we have trained advanced midwives, and even this year, these postgraduate students were trained in the same also training and helping baby breathe. Now we wanted that to go to the regions, because the Ministry of Health and Social Services is our main stakeholder. It's not just that they provide platform for our students to be trained, but they are our major stakeholders because they are the custodian of the health in our country. So we contribute to make sure that how do we equip the midwives who are in a far region to also to be trained in this also, and HBP, which is now helping baby breast. And Omusati Region was actually chosen because some of these students that come for UNAM for specialization came from those regions. So it was targeted so that we can also equip our alumni and also at the same time also train other midwives. So that's why we end up at Outapi and the importance of this training.
What challenges in maternal and newborn health care were highlighted during the training session at Outapi?
The aspects that were highlighted in this training is similar to what was in Vendu. So first of all, they highlighted on a preventable death. The participants or the midwives, first, there were some models that they were trained on how to deal with a postpartum hemorrhage. So it's a mother who's bleeding after birth, and usually this is one of our major causes. And the reason why they are trained in this is that the midwives are usually the first person that our clients will see in the public sectors. So they were trained on managing PPH. They were trained even to be able to measure the amount of blood loss using these simulated equipment. And they also had an opportunity of case scenarios on how to manage preeclampsia, which is also now this hypertension that is also a causes of our maternal death in the country. And then they also look into infections, shock or infection during pregnancy. And then what is also important, they also look into the maternal resuscitation. So it's what if a mother comes to their settings, and this mother, whether she lost blood or anything happened, and she need to be resuscitated, what do you do? So these models, the midwives will have an opportunity to do a hands-on simulation with models that will show color, green, red, or orange, to make sure that your compression is correct. The chest can actually rise up when you are doing the ambubirth. At the same time, they were also trained on how to resuscitate a newborn within 1 minute after birth using this model. So that was some of the aspects were covered, but it was mostly hands-on simulation where they practice in groups over and over till each midwife get at least the necessary competency.